What's up, everybody? This is Chris here. Sorry I haven't posted a video in who knows how long. Been busy. Just thought I'd let you guys know I passed my NCLEX for RN examination. I am now a registered nurse. The best piece of advice I can give to people who are studying for their NCLEX or any other type of exit exam, such as ATI, TEAS test, Hesi, which is what my school used to pass the, to graduate. It took me 4 attempts to pass it, but it all depends on the type of studying that you're doing. And I say this very thoroughly because you can study a whole bunch of questions, how it's always told to us in the beginning, first day of nursing school, that you need to do questions, 100 questions, 1,000 questions per quarter or semester or whatsoever. But what you guys need to do is be able to apply that knowledge into answering the questions, as far as priority of questions, assessment questions, intervention questions, teaching, delegation, patient assignment rooms, your psych questions as far as therapeutic communication, things like that is what you need to be able to understand and to be able to apply when you're answering the questions. And that's what a lot of people are failing the NCLEX, because they're not understanding how to answer these questions. I know some people that I graduated with and other people that I've been communicating with through Facebook, YouTube channels, whatsoever, personal life. A lot of people use the new Saunders edition. I think it's the 6th edition. It looks like blue and purple. I know a few people that have actually read that from front to back, along with some other things that did pass their NCLEX. I didn't do that. I highly suggest you guys looking on to simplenursing.com by Mike Linares. He really explains a lot of the, you get your content, the lecture's not long. It's maybe about 5 to 10 minutes long per lecture, and the material, depending on what it is, some takes, there's parts to it. One of the things that he does talk about is priority and delegation. And to be able to understand that, because you're not going to be able to use that for a good amount of the questions, like your teaching, patient assignment rooms, things of that nature, because it is important, but it's not relative to that. That's a whole different area, but he does explain it in other videos. But the main part of the videos that he does talk about is answering the priority things. If you guys can be able to understand that and to be able to apply the information that he talks about on it, it's really helpful. I watched quite a few of his videos from that, along with videos from other people who's talking about priority. My main source of what the material I used to pass my nclex-RN examination, I passed it the first time. I used Kaplan, because Kaplan does give you content review. They have 3 different programs. They have the on-demand, which is videos you can access at any time. It goes to OB, maternal, everything that you need to go on there, but it has lectures on 5 of the categories that NCLEX tests you on, such as safety, management of care, pharmacology, delegation. It describes it for you, along with what NCLEX tests you on as far as passing is considered competency for when you're supposed to be taking your NCLEX. It's really good because it has a pre-test as far as the diagnostics to see like what level of competency you're at. And don't be discouraged if you're getting like a 50 or 60 percentile range, because that's where I was scoring at, but it's just letting you know the areas that you need to focus in, so that way when you're getting the lectures and when you start listening to them, you're able to actually, okay, I need to write this, or I need to know more about this syndrome or these type of complications, because that's what you guys need to be focusing on. Now also, with it has post-test for you. It has like 7 tests, and it has a readiness test. I didn't have enough time to be able to do those tests because I was stressing and a whole bunch of other things was going on during that time and working and everything. So I didn't push my time to do those tests, because I in my personal perspective, I was ready to take it. Although I got all 265 questions on my NCLEX. And the thing I want to add on to that, or elaborate, a few people that I know that got the whole 265 questions, it's hard because you're sitting there question after question after 75 waiting for the computer to shut off. That's what everybody wants, 75 questions and then stop. Well, I can tell you 3 people in my class, well, 2 of them stopped. One stopped at 75 questions, the other stopped at 76 questions, and they both failed the NCLEX. And the reason that you guys need to go back into understanding how to answer these questions is because if you're not understanding these questions, if you're not getting at least thoroughly answer them correctly to where you're at a passing bar, the NCLEX is going to shut off the computer and determine that you failed, like you cannot reach competency. That's why the computer shuts off if you fail. Or if you're getting those low amount of questions, bam, you fail. If you're at 265, it's because you're not so much proven competent. You may be proven competency, but may not be at the bar, or you're just over and they're just pushing your level, or you may be below it. So don't get discouraged if you're getting all, like the computer's not stopping. So just keep answering the questions, keep going, don't give up. Just keep going as far as you can. But back to the Kaplan, but they have those post tests for you. So, you know, if a lot of people that I notice on allnurses.com, along other sites, they say like they scored a lot better, and they use that material as far as studying for their nclex-RN examination, even their LPN examination. So it's a really good source. I really liked it because I'm not so much of like answering a whole bunch of questions, because you can answer questions all day and you're still not understanding. You may understand why you may got the question wrong because of a certain disease process, but you need to understand what the question is asking, what information is given to you, and how to answer that question or those type of questions. That's why people fail the NCLEX, and people can pass because they know how to answer those questions. So I really highly suggest those people who haven't passed their NCLEX or are about to pass their NCLEX, is a really good tool to use through Kaplan. Now for your exit exams, such as ATI, Hesi, TEAS test. Now my school did the Hesi. I did take a TEAS test a few years ago, but it was for a different program, so I'm not really going to get into detail about that one because I'm not too familiar, you know, as far as post-examinations for that, for graduation. Now for ATI, I'm very familiar with it because, well, somewhat familiar I should say. A lot of the schools around me for nursing programs, they do use the ATI program. A lot of people that I've met over the time said they use the Saunders book, either the 5th edition, which is a yellow book, or the new Saunders, which is the blue and purple book. You can use that to study for your NCLEX, for your exit exam for ATI, because it does come with a whole bunch of questions, material, rationales, but it does have a CD for you too. So that's a good tool for you guys to use. For people who are taking their exit Hesi, I would suggest using the Hearst review. It's a very broad content review for your OB, burns, mental health, renal, pretty much every body system. Your well, not so much medications, but your fluids, like your hypertonic fluids, hypotonic fluids, isotonic fluids, your burns, I already have mentioned that, thyroid problems, pediatric care, nursing, cardiac, those type of things you're going to see on your exit Hesis. And you're not going to, you are going to see dosage questions, and those are going to save you because they're worth a lot of points. But I suggest going back onto YouTube and looking up how to answer dosage questions. Just type in nursing dosage calculations for nursing students, and there you see a whole bunch of people, you know, posting videos as far as how to answer those questions, things like that. If you guys can answer those questions, it'd be really good. That way you can keep that material to when you're studying for your NCLEX as well. You may not get a lot of dosage calculation questions, but it's very good to know those. So as far as answering exit questions, well, exit exam questions, or what tools to use for that, it's very good to have just an overall broad review because it's just content material. NCLEX is a little bit more difficult because it's so much as, okay, well, here's this, but what do you know specifically? Like, I'll give you guys an example. You have a patient who's displaying visual disturbances from a dose of, you know, from medication side effects. So what does the nurse's judgment as far as what, you know, can cause this? And some of your choices may be digoxin. Well, we all know digoxin, a common side effect, well, a toxic effect, is the green halos. Well, if you know green halos is something with the visual, it's a visual disturbance. So that would be a relative, because it's not so much directly is, you know, you're just going to see it on your symptoms, like, oh, visual disturbances. It's going to say green halos, toxic effect. But you want to be able to, you know, have some type of relevance or be able to understand your A&P to where you can pinpoint those things that are common. So that's why you guys need to go back, learn how to answer those questions, go over your content, go over your A&P is very important. I can't stress that enough also. But that's really good if you guys want to know more information about NCLEX. I can't give full because, you know, there's things, but any like studying tips or ways to go about how to study or, you know, things like that, you guys can message me here. I do have a Facebook channel. You guys are more than welcome. I do have it here in my profile. But yes, anything you guys want to know. NCLEX is very hard, but once you guys study, you feel really great. Take it, you know, you won't find out for 48 hours. Even if you're trying to do the quick results, you can also look up your name on the board of nursing, find it. But once you pass, you guys, it's an amazing feeling. Even for your LPNs, it's the same exact way. But RN students, like, good luck. It's really just study as hard as you can for the NCLEX. Alright, you guys, I'm going to let you guys go. Have a good day.